Good afternoon. Can you hear me? So today we are going to learn about stress and stress management. Pathophysiology of stress. Our over-industrialized and highly competitive metropolitan culture has added up to our stresses at many levels. The media also in a way provides certain constructs which in their turn create stress and anxiety about our bodies, level of success, status, gender roles, and other perspectives. Sometimes violence, gendered or otherwise, along with repression, neurosis, loneliness, and other psychological factors lessen the well-being of an individual, both physically and psychologically. Stress is body's way of responding to the demand which is caused by both good and bad events and experiences. The objectives of the present session. After the end of the session, you will be able to describe the changes that occur in the internal environment of the body in response to stressors. And you will be able to describe the importance of stress management programs. The participants will be able to perform progressive muscle relaxation. Now we come to stress responses of the body. The body reacts by releasing chemicals in the blood to combat this demand by a complex repertoire of behavioral and physiologic adaptive responses. Stress experiences often lead to various chronic health conditions such as hypertension, coronary heart disease. To make this world a better place to live in, we need to make individuals conscious of the fact that the positive health of a person depends on both the body and the mind. Now let's learn something about homeostasis. Life exists through the maintenance of a complex dynamic equilibrium termed as homeostasis. Homeostasis of our body is constantly challenged by internal or external adverse forces, that is, stressors. Stress is defined as a state of threatened homeostasis and is counteracted by a complex repertoire of physiologic and behavioral responses that re-establish homeostasis, that is, maintain the constancy in the internal environment of the body, the milieu interior. Allostatic load develops due to persistence of chronic stressors. Now let's see what is perceived stress. Perception of stress is influenced by one's experiences, genetic and behavior. When the brain perceives stress, physiologic and behavioral responses are initiated, leading to allostasis and adaptation. Over time, allostatic load can accumulate, and the overexposure to neural, endocrine, and immune stress mediators may have adverse effects on various organ systems, leading to disease. Now we will discuss about the allostatic overload. Allostatic overload is caused by chronic states and may lead to decreased immune function, hypertension, atherosclerosis, increased platelet reactivity, abdominal obesity, diabetes mellitus, bone demineralization, atrophy of neurons in the hippocampus and prefrontal cortex, increased activity of amygdala, problems in digestion, addiction, depression, anxiety, even infertility. Optimal interaction of the nervous system, the endocrine system, immune system help in maintaining homeostasis. You can see in this picture, there may be multiple environmental stressors, some major life events, say death of a relative, trauma, abuse, all these can be stressors. There are some individual responses. These may vary due to genes, development of a person, due to experience. And there are some behavioral responses that occurs. And there are some physiological responses which leads to allostasis and adaptation. Finally, there may be increase in allostatic load due to chronic exposure to stressors. Chronic stress can activate the hypothalamo-pituitary axis, that is overactivation, releasing of excess cortisol. There is activation of the autonomic nervous system, that is especially the sympathetic nervous system, release of catecholamines, and there may be inflammatory changes, prothrombosis, hyperactivation of the renin-angiotensin-aldosterone system, oxidative imbalance, sympathetic overdrive, and endothelial dysfunction. All these increase the risk of cardiovascular diseases. That is atherosclerosis, microvasculopathy, perfusion deficit, impaired tissue and organ function. Now let's see something about the human brain. It can be divided into 3 levels. One is the vegetative level, the reticular activating system of the RAS, and the brainstem. The RAS is the connection between the brain and the spinal cord. Brain consists of that is the brainstem. It consists of the pons, medulla, and mesencephalon. Brainstem is involved in regulation of involuntary functions of human body. The limbic system. The hypothalamus, along with the limbic system, is involved in emotional expression and the genesis of emotion. It has limited number of connection with the neocortex. Neocortical activity modifies emotional behavior, and the limbic system also modifies the action of the neocortex. The limbic circuits show prolonged after discharge. For this unique feature, emotional responses are generally prolonged and remain sustained even after the stimuli fade off. Say you are a new medical student, you have been admitted in this medical school. So you could clear an entrance test for getting into this course. So you felt very happy. Did the happiness go away immediately? No. It lasted for a few days, maybe for a few months. There is death of a family member. So you are in a sorrow. The emotion doesn't die off immediately due to this phenomena of after discharge, which is a peculiarity of the limbic circuits. Now the neocortical level. The highest level and most developed areas of brain responsible for processing of sensory information and cognition, analysis, imagination, intuition, creativity, logic, memory, organization, all are the functions of neocortex. This region can override the functions of lower levels of brain, and thus conscious thought can influence emotional responses and also the involuntary responses like heart rate, respiration, and even blood flow. You can see in this image showing thalamus, which is the sensory relay station, the cerebral cortex, the hippocampus, the pituitary glands, the brainstem consisting of the midbrain, pons, medulla, the spinal cord, the cerebellum. Now we come to stress responses. Stress response relies on neuronal pathways of cerebral cortex, the limbic system, and the hypothalamus, the thalamus, the pituitary gland, and the reticular activating system. The cerebral cortex deals with vigilance, cognition, and focused attention. The limbic system, as we have already discussed, is associated with emotional components like fear, rage, anger, maybe happiness. So these are the functions of the limbic system. The thalamus acts as a sensory relay station. Hypothalamus coordinates endocrine and autonomic responses. The autonomic nervous system. There are two subdivisions, the sympathetic and the parasympathetic. And they are functionally antagonistic in nature. And most organs receive both sympathetic and parasympathetic innervation. Emergencies that cause stress and require us to fight and flight are responses evoked by the sympathetic system, whereas non-emergencies which allow us to rest and digest are parasympathetic responses. You can see here the image of the sympathetic nervous system. It is the thoracolumbar outflow. You can see here the pre-ganglionic fibers are short, while the post-ganglionic fibers, you can see they are long fibers. This is the thoracolumbar outflow. The sympathetic nervous system integrates the flight and fight responses. There is release of norepinephrine and epinephrine. The sympathetic nervous system, it also has a companion gland, that is the adrenal medulla. There is increase in heart rate and blood pressure, increase in respiratory rate, bronchial dilation, increase in conversion of glycogen to glucose in the liver, increase in pupillary diameter, decrease in gastrointestinal activity. Effects of adrenal medullary axis stimulation: increase in arterial blood pressure, increase in blood supply to the brain to a moderate rate, increase in heart rate, cardiac output, increase in stimulation of skeletal muscle. There is increase in level of plasma-free fatty acid, triglyceride, cholesterol. Also, there is increase of release of endogenous opioids, decrease in blood flow to kidneys, decrease in blood flow to gastrointestinal system. So there is decrease of these things. Now, effect of adrenal medullary axis stimulation: decrease in blood flow to spleen, increase in risk of hypertension, increase in the risk of thrombus formation, increase in risk of angina pectoris in person prone to it. So there is also increase in risk of arrhythmia, sudden death from lethal arrhythmia, myocardial ischemia, fibrillation, infarction. Now we come to the parasympathetic nervous system. It is the, see the picture, it is the craniosacral outflow. So the sympathetic nervous system is towards the thoracolumbar outflow. Here it is the craniosacral outflow. The parasympathetic nervous system integrates the rest and recreation. There is release of acetylcholine, decrease in heart rate and blood pressure, decrease in respiratory rate and bronchial constriction, decreased conversion of glycogen to glucose in liver. There is pupillary constriction and increasing GI activity. Well-established endocrine axis associated with stress responses are adrenocortical axis, somatotropic axis, thyroid axis, posterior pituitary axis, and the reproductive system. Now we come to stress and coronary heart disease. The highest coronary mortality at present is seen in European region, followed by Southeast Asia region. India falls in this region. There has been considerable increase in prevalence of coronary heart disease in urban areas in India in the last decade. Risk factors for development of coronary heart disease are modifiable and some are non-modifiable. Stress is a modifiable risk factor. Now, let us come to medical education and stress. Medical education is inherently stressful and emotionally demanding training. Sudden exposure to the vast and stressful course of MBBS. Now, the young medical students, due to this exposure, experience a lot of stress. So, the stress management program has been included in the foundation course by the Medical Council of India and now the National Medical Commission. Inadequate rest and leisure time the students have, and they cannot prepare properly for exams, and they fail to coordinate between learning and teaching. All these add to their stress levels. The medical students of today will be doctors of tomorrow, and if more attention is paid to decrease their stress levels in early schools, this will improve the quality of their life and, most importantly, patient care in future. So, you are the new medical students and you are exposed to many stressors. You will have to learn how to manage your stress levels. In the modern society, stress is universal and relevant to all. A thorough understanding of stress management techniques is essential. This may promote prevention of stress-related disease and enhance health. Stress management techniques needs to be incorporated into all levels of prevention. The need of different population in different settings should be addressed while implementing these strategies. So when you teach somebody some stress management programs, you need to consider whether the person stays, whether he will be able to take up and practice the stress management technique that you are teaching the subject. This COVID-19 pandemic has the potential to significantly affect the mental health of medical professionals as well as medical students, as they are the front-line workers during this hour of crisis. Isolation and loss of social support, risk or infections of friends and relatives, and unsettling changes in the working conditions are further compromising the resilience of the students. Medical students are therefore especially vulnerable to mental health problems, including stress, anxiety, depression. Studies have demonstrated that there is lack of awareness of own mental health problems among healthcare professionals, and psychological problems be more prevalent among younger age groups. So medical students need to be made aware of their mental health status in early medical schools so that they can take up some stress management programs to make their lives better and take care of the patients in a better way. Stress management programs, lifestyle approaches for cardiovascular event prevention are recommended for all. We know that. Now, women have a life expectancy advantage over men. But women are more affected by stressors than men. Yoga, meditation, hypnosis, progressive muscle relaxation help to reduce perceived stress. Progressive muscle relaxation has been used in various health conditions like hypertension, diabetes, migraine, epilepsy. Now let's discuss about some stress management programs. First, we come to yoga. Yoga is an old tradition. It is regarded as a complementary and alternative medicine in Western world. Yoga is a mind-body technique which involves a relaxation, meditation, and a set of physical exercises performed with synchronized breathing. Practicing of yoga may benefit mental and physical health by modulation of hypothalamo-pituitary adrenal axis and sympathetic nervous system outflow. Now we come to benefits. Yoga encourages one to relax, shifting the balance from sympathetic to parasympathetic tilt. Thus, it lowers breathing rate, heart rate, decreases blood pressure, lowers cortisol levels, and increase blood flow to intestines and vital organs. Many studies have demonstrated that yoga lowers the resting heart rate, increase endurance, and can improve VO2 max. Now we come to relaxation exercises. Progressive muscle relaxation, relaxation response, biofeedback, autogenic training, guided imagery, diaphragmatic breathing, transcendental meditation, cognitive behavioral stress reduction, and mindfulness-based stress reduction have all been recognized as effective methods for reducing stress and anxiety. Now we come to progressive muscle relaxation. Progressive muscle relaxation is a technique used for reducing stress and anxiety by alternately tensing and relaxing different groups of muscle. It was developed by Jacobson in early 1920s. Muscle tension accompanies anxiety. One can reduce anxiety by learning how to relax the muscle tension. Progressive muscle relaxation entails physical as well as mental component. Now we come to biofeedback. Functioning of different systems of human body can sometimes be controlled by monitoring their results. In biofeedback assisted relaxation, this principle is followed. Biofeedback has its roots in the concept of homeostasis, that is, maintenance of constancy in the internal environment of the body. This was introduced in 1969 and coined by Werner Feedback. This process enables individuals to learn how to change physiological activity for the purposes of improving health and performance. Now we come to guided imagery. GI is a well-established stress management strategy used by Native Americans. The technique used were systemic desensitization, aversive imagery methods, symbolic modeling techniques, implosive therapy. Joseph Wolf in late 1960 introduced several related techniques in behavior modification theory. Now we come to Transcendental Meditation. TM is a simple psychophysiological stress reduction procedure. It was introduced to the West by Maharishi Mahesh Yogi. The technique is simple and can be learned easily. It requires to be practiced 20 minutes twice daily to get effective results. TM is taught through a 7-step course of instruction by a certified TM instructor. Now we come to cognitive behavior therapy. The cognitive behavior therapy was formed by merging behavior therapy with cognitive therapy. CBT is a well-established, evidence-based, structured, and time-limited psychological treatment. CBT has been effectively used in anxiety disorders, major depression, insomnia, headache, tinnitus. Now we come to mindfulness-based stress reduction. Mindfulness-based stress reduction was first introduced by John Kabat-Zinn et al. In 1979. MBSR classes are usually taught by physicians, nurses, social workers, and psychologists. Cognitive therapy-based exercises provide link between thinking and its resulting impact on feeling. It is a structured 8-week group program. Mindfulness-based meditation is used to alleviate mental and physical suffering associated with physical, psychosomatic, and psychiatric disorders. Systematic mindfulness-based training may influence brain areas involved in regulation of attention, awareness, and emotion. Now we come to diaphragmatic breathing. The natural act of breathing has long been used as a means of relaxation. Breathing exercises were traditionally included part of different yoga traditions. They have now been incorporated in many relaxation programs. Diaphragmatic breathing is the procedure of breathing by expansion of the abdomen rather than the chest while breathing. Diaphragmatic breathing is defined as a manipulation of breathing movement, contributing to a physiologic response. Now we come to autogenic training. Autogenic training is a self-relaxation procedure by which psychophysiological determined relaxation response is elicited. It consists of 6 standard exercises, use of visual imagination and verbal cues, make the body feel warm, heavy, and relaxed. Autogenic training is useful in a broad range of disorders. Now we come to relaxation responses. The important characteristics of a relaxation program are as follows: repetition of a word, sound, prayer, thought, phrase, or muscular movement through which concentration is achieved, passive return to the repetition when other thoughts intrude. In 1960, Benson observed that there is counterbalancing mechanism to the stress responses. Stimulation of an area of the hypothalamus can cause stress responses, while activating other area of the brain results in relaxation. He defined this opposite state of stress as the relaxation response. Now we come to emotional freedom technique. Emotional trauma contributes greatly to disease. Scientific studies have shown that emotional freedom technique is able to rapidly reduce the emotional impact of memories. Once the distress is reduced, the body often rebalance on its own and thereby accelerate healing. During EFT, a person taps on 9 acupoints. This is done while speaking aloud a specific, meaningful, short phrase. Now, I will be teaching you progressive muscle relaxation. This is a technique easy to learn, and you can practice it anytime, anywhere. Maybe many of you are staying in hostels. Maybe you are staying in a PG accommodation. Maybe you have a small space to do relaxation exercises. Anywhere you can anytime practice this exercise if you like. Just practice it for 20 minutes daily for 3 months and feel the change that occurs. Now I will give you some instruction. Please follow them and practice this relaxation exercise with me. This training involves tensing specific group of muscle for 7 to 10 seconds. So you will have to tense your muscle, the muscle that I will give command, you have to tense it for 7 to 10 seconds. Then you will have to release the muscle for 15 to 20 seconds. The exercises, you can start from the face and end in the feet, or you can start in the foot and end in the face. Now let's begin. Settle into a comfortable position. You can do it while lying down. You can sit in a comfortable position and also do it. Take in deep, slow breath through your nose. Don't take breath through your mouth. Take in through your nose. Take in deep, slow breath through your nose. Hold. Release. Feel the sensation of relaxation as you breathe out. Forehead. Bring attention to your forehead. Tense your forehead. Raise your eyebrows as high as you can. Hold. Feel the tension. Relax your forehead. Close your eyes very tightly and wrinkle your nose. Hold. Relax and let the discomfort fade away. Now come to the face. Put your mouth into a forced smile. Clench your teeth very tightly. Lips, jaws, and cheek should be very tense. Hold. Feel the tension. Relax your face. Feel the sensation of relaxation. Neck and shoulders. Tense your neck. Shrug your shoulders. Try to touch your ears with your shoulder. Feel the tension in the neck and shoulder. Let go. Relax. Feel the sensation of relaxation. Hands. Squeeze your hands into fists as much as possible and hold. Feel the tension in the hands and forearm. Relax. Arms, hands, and shoulders. Face your palms against the floor. Push hands towards the floor. Hold. Feel the tension. Relax your hands, arms, shoulders. Now come to the chest. Take in deep, slow breath. Hold it for count of 4. Breathe out. Feel Increased sense of relief in your chest as you breathe out. Relax your chest. Muscles of back, arch your back. Have a pillow under the middle and lower part of your back. Try to put your shoulder blades together. Hold this position. Relax and feel the sensation of relaxation. Now come to the abdomen. Squeeze your abdomen. Hold this position. Feel the sensation. Relax. Feel the sensation of relaxation. Come to the muscles of your leg. Push down the heels against the floor. Tighten your calves. Back. Squeeze your legs. Hold. Feel the tension. Release. Feel the sensation of relaxation. Muscles of feet. Curl the toes. Tighten muscles of your feet. Hold. Feel the tension. Relax and feel the sensation of relaxation. Mental health is a major concern worldwide. 14% of global burden of disease at present is attributed to neuropsychiatric disorders. Mental health awareness campaigns in the past have yielded to some extent positive health outcomes. Lack of knowledge about mental illness poses great challenge to mental health delivery care system. Mental health literacy is a related concept which is increasingly seen as an important measure of the awareness and knowledge of mental health disorders. The large Indian population needs to be made aware of its mental health need, which will generate its own demand. With rising awareness, early recognition of mental problems and access to treatment will follow. So you need to be aware of your own mental health status as well as the doctors of tomorrow. You need to make people aware of their mental health status for positive health. Now, medical students undergo significant stress during training. We have already said this, which lead to their own suffering or problem in patient care. High level of burnout and depression is also not uncommon. The transition from preclinical to clinical training has been regarded as crucial to students in relation to stress. Suicide among younger generation is one of the grave public health problems. Now we come to mental health issues. In Hungary, 1,395 young people below 24 years of age lost their lives due to suicide between 2000 to 2010. Among them, 1,150 were males and 245 females. Epidemiological studies showed that 24.7% of children and adolescents suffer from some form of conduct, behavior, or other psychiatric disorders. Among adolescents, suicide was the leading cause of death in 2010. Victims of suicide are not healthy either physically and mentally, but they fail to recognize that they are not mentally healthy. And so though they don't seek any help from others. So we need to make the population aware about mental health, that you need to take care of your physical as well as mental health to remain healthy. Sociological stress research, comprehensive measurement of stressors provide substantial evidence regarding their damaging impact on physical and mental health. Gender, marital status, racial, ethnic, social class inequalities all contribute significantly to the stressful experiences of our life and have major impact on physical and mental health. Minority group members are additionally subjected to discrimination stress. Stressors may proliferate over the course of life across generations. The impact of stressors is reduced in persons having high levels of mastery, social support, and self-esteem. Obesity. Asian Indians are a high-risk population for both metabolic syndrome and cardiovascular disease. The distribution of body fat is different in Asian population as compared to European population, and the distribution of body fat in different proportion of the body is also important for development of cardiovascular disease. Central obesity being a very important factor, and the distribution of body fat in us, that is Asians, is different from European population, American population. Progressive muscle relaxation may help in reducing stress-related obesity. Pulse and blood pressure. Significant decrease in resting heart rate and blood pressure of subject have been observed in different studies following progressive muscle relaxation technique. Progressive muscle relaxation technique is known to increase parasympathetic activity and reduce muscle tension, improve concentration, and leads to a sense of well-being. Blood sugar, fasting sugar may significantly decrease following progressive muscle relaxation technique, as has been found in different studies. Perceived stress has been found to be a strong risk factor for development of type 2 diabetes. This may give a new pathway for diabetes prevention trials and clinical management. Now we come to lipid profile. PMR has been shown to decrease LDL cholesterol, total cholesterol in different studies. LDL cholesterol is known to decrease baroreceptor sensitivity, and total cholesterol decreases heart rate variability. A reduction of LDL cholesterol and total cholesterol following relaxation exercises may contribute to increases in HRV and tilt the autonomic nervous system activity towards a parasympathetic dominance. Now we come to electrocardiography. Body reacts to stressful circumstances by increasing sympathetic nervous system activity and reducing vagal control of heart and blood pressure. PR interval, QT interval, and RR interval may significantly increase following progressive muscle relaxation technique. Longer PR interval may be beneficial in long run as it gets enough time to empty its content into the ventricles, which is important to maintain a proper cardiac output. The QT interval represents electrical depolarization and repolarization of the ventricles. Like the RR interval, the QT interval is also dependent on the heart rate. Now we come to the pulmonary function test. Pulmonary function test may significantly improve following progressive muscle relaxation. Psychological factors have been suspected to influence lung function in asthma patients. Earlier experimental researches have demonstrated the susceptibility of airways to suggestion. Recent studies have thoroughly investigated the impact of various emotional states and stressful challenges on the airways in healthy and asthmatic individuals. So you have to take up some relaxation exercises, maybe some yoga, maybe PMR, maybe autogenic training, maybe other therapies from early life, so that you can perceive less stress even when there is a change in your external as well as internal environment. There is two, you go online, there are two stress scales available. You can download them, the Perceived Stress Scale of Sheldon Cohen and the Dash 21. Just go through them and fill them up to find out your own stress levels and the dash scores. All the instructions, how to do them is given along with, you can follow them. There are PDFs available online, or you can contact me in my mail or WhatsApp number. I will be providing them to you. Thank you. Keep well. Bye.